So, welcome to the next Neuro Nugget podcast. And today I'm joined by the amazing Zoe Powley, who is, now, if I get this right, a psychotherapist. Is that correct?
Yes, that's right. Yeah.
Excellent, excellent. So, today I wanted to talk about a couple of really interesting topics, and that is, we've brought you on specific because as a coach and somebody with a background in mental health, but I'm not a therapist, I'm not a psychologist, I'm not a psychiatrist. But we thought, let's bring on somebody that knows more about that than I do, and therefore Zoe and her with a okay, I'll not say it, but with a lot more knowledge and experience than I do, we thought that would be a great combination to talk about the difference between therapy and coaching, and then if we have time, and because I've mentioned it, we'll make sure we have time. I want to talk about trauma and what happens in trauma. How does it come about? How does it manifest? What's that all about? So yeah, so let's start with Zoe. How did you become a psychotherapist? What's that all about? Tell us a bit about you.
It depends how far you want to go back, Dave. But so when I left school, I was a secretary to start with, trained up at college, and I worked in a community mental health team. And I saw what everybody else was doing and thought, oh, I like the look of that. So I did my mental health nurse training. I was mental health nurse for a while. And as you'll be aware, when you do your mental health nurse training, you taught how to assess and to relate to people and to support people. But I felt like I needed something a little bit more, a modality of supporting people. So I'm a psychotherapist, but I'm what they call a cognitive behavioural therapist. And I think that was something that really appealed to me because, it just felt like it fitted. It's not what happens to you, it's how you make sense of what happens to you, really resonated with me. And that's one of the main ethoses. Is that right? Is that the right word? But
we'll go with that.
Yeah, the CBT was to help support people with trying to manage the way that they feel, but doing that by looking at how they appraise, how they make sense of situations and the way that they then respond. And it's not very easy, is it, just to change the way you feel? Otherwise we would do that. But to help people maybe challenge the way they're thinking about things, how helpful is it? And to make changes to their behaviour. Still not easy, but it made sense. So I think that's what led me into wanting to train to be a cognitive behavioural therapist.
Wow, that's super interesting. And there's a point that you said there about that really resonates with me about, how do we about that changing that our own behaviour, and that kind of resonates with me in the neuroscience stuff around, and I wonder whether habit and trauma are opposite sides of the same coin, really, in that, and we'll probably go into a little bit more detail about this, about, this trigger, the behavior, and then the reward that sort of cements that issue, and how we interpret the world, and therefore, whether we see these triggers that then set us off.
Yeah, we are a product of our experiences, aren't we? From a very early age. I mean, even Bowlby talks about the first 2 years of your life forming this blueprint for how we view ourselves, the world, and other people, and our responses. And we're then conditioned, aren't we? And like you say, with reward or threat, based on what we've learned early on.
Yeah,
so it kind of feels like a very normal response, and normally we can get away with that, and that's what forms us and our personalities. But I suppose for some people that becomes problematic when they've either experienced a lot of traumatic stuff, or when their responses cause problems in society and the way culturally we're expected to be.
Yeah. So that makes me think then, that, so if we have somebody that comes to therapy, for example, and says, I'm struggling, what do you think that means, or what do they mean, and what might be their actual experience underneath, or what might they be experiencing underneath, rather?
Gosh, I'm going to come across as very CBT now, I'm aware of my response to this. But I suppose from a CBT perspective, there's this idea that we all put rules into place to cope with the way that we view the world, ourselves, other people. We all put rules in place that we live by. So if I use myself as an example, I have a bit of a belief that I should keep other people happy at all costs. I know it's not helpful because you can't always achieve that, but a lot of the time you can achieve that, and you can function, and you can move along, and you can keep people happy by saying, oh yes, I'll help with this, or I'll do that, I'll help you, I'll help you get better. But there are times in life where things happen where you're not able to always keep people happy, or you have to make choice about who you're keeping happy, for example. And that's where the struggle comes in, when there's conflict with the rules that we have for ourselves and our expectations and things that life throw at us that kind of mean that we can't follow the rules. And we all put rules on ourselves. So I think that's one side of things, but also the struggle, I think, can come sometimes from, which I think probably fits in more with the neuro side of things, is that our head and our bodies and our felt sense can be two different things. So our head can know something, but our bodies can feel something very, very different. And again, I'll use myself as an example with flying, that I know rationally that it's one of the safest forms of transport. I get on that plane and emotionally my body will take over and we're going to die. So as far as struggles are concerned, I think the struggle can be with rules, but it can also be between that conflict between our heads and our bodies and our sort of, whether it's physiological or our emotional reactions. Does that make sense?
It does. Because and again, I guess I say what I'm hearing, but actually I think what I'm making an assumption of is that, well, clearly you managed to go on holiday and you stay on the plane because there's a reward at the end that probably outweighs the I'm probably not going to die. Of how. And this is where I think it probably gets a bit super nerdy but really fascinating. Of how do we then how do we talk ourselves through well, I'm not actually going to die, and we'll get through this. I mean I think this is a really big question, and actually I think there's probably some, and I think this is where we get the overlap. We need to talk about the differences between therapy and coaching, but let's stay with this for now. How do we, how do you talk yourself through staying with the issue and going, I'm going to get through this?
I think it's really hard. I think you're right when you say about motivation, isn't it? And having that reward at the end is really important. I think if we experience something, we put ourselves through something once, then we've got that memory of, well, yes, this is horrible, but I did it before and I managed, therefore I can do it again. And that, I suppose that explains habituation theory, where the more you repeatedly do something, the more the emotional intensity comes down. And I think it is about us tolerating anxiety, isn't it? And it's putting ourselves through it and facing up to it. And it feels really uncomfortable. And I think sometimes we expect that we shouldn't, or, something wrong about us if we do experience that intense anxiety. But actually, we do put ourselves through anxious situations. And for me, certainly, it is about motivation as to whether I'm prepared to do that or not. But you really do feel it at the time.
You do, don't you? I think you do.
Sometimes there's levels, aren't there? If this is again very CBT of me, but if we think about 0 to 10 scales of anxiety, there's something about when does rational thought cut off. So I know that if I'm between a 0 and a 6 or 7 out of 10, my rational thought still plays a part. My prefrontal cortex bit still kind of going, oh yes, this is the kind of sensible way of viewing this, or the rational way of viewing it. But if I'm an 8 and above, that just completely goes. My fight and flight's completely in charge and taking over. And that does make things more difficult.
Yeah. And do you know what, funnily enough, because I was talking recently to a group of coaches about something that you mentioned there, but which we call, from a neuroscience point of view, is experiential blindness and I showed them a picture of just black and white blobs, and they, because they'd not seen the picture before, it was just looked like black and white blobs. They couldn't work out what it
Yeah.
was. And once I then showed them the picture with proper colour, and they realised it was a snake, there was really interesting. There was some,
Yeah.
even though it was a picture, there was some really interesting reactions because a lot of people went, "Oh, I don't like snakes," even though it's not a real snake. It was just a picture of. You could see the reactions that people had,
Yeah.
and then when you went back to the black and white blobs, they could still see the snake, which they couldn't before. And that whole idea of we only when we have an experience to pull on can we then make sense of something. And
Yeah, it's our
actually,
appraisal, isn't it? It's that kind
yeah,
of sense making.
yeah.
Yeah.
And actually, if we've then, the first time we've had an interaction with something and it was negative or very emotionally charged, then we are more likely to have then an adverse reaction the second time we
Yeah.
encounter that same thing, because our brain just goes to the memory that says we need to pay attention to this. This makes us felt uncomfortable.
Yeah, and I get that, and I agree with you. However, there are some people then who talk about, and I kind of can see this as well, about evolutionary theories and about certain phobias, certain fears, and why do we have this specific fear? And has this come from an experience, or is this something innate that is part of our genetic makeup to become scared of because our ancestors struggled with this? Even the fight and flight system, that false alarm going off because of cavemen and their need to fight and to run. So it's an interesting one, but I don't know the answer.
No, I mean, I guess we're getting into the nature versus nurture question, aren't we? Of, as well, because we can proper. We'll not go off on this tangent, but there's a whole other conversation about social connection, isn't there? And how where as a species we are wired to connect socially, because what we recognize is strength in numbers. Again, going back to the caveman days, as you mentioned, that whole idea of if we all go out and gather food together, we're more likely to be successful, and therefore we're all likely to eat and survive. And it adds it's safety for protection, and all of that sort of stuff. So we also know that experientially, then, as a group of us, when we go, we don't like snakes, whether I've encountered a snake or not, the rest of the group are telling me, stay away from that. So there's something about that nurture bit of collectively, even though I might not have directly experienced one, I can identify what a snake is, and therefore I don't like it because my group are telling me it's not safe.
And we want to fit into our group or our culture. So it's then easy to think, I'm going to think the same way as these people because I don't want to be different. I want to fit in subconsciously, maybe.
Yeah. And I think that's a really powerful point, isn't it? Of that need to fit in, and that need to to kind of really and bond with others. And we also know, again, from the neuroscience stuff, is that when we bond with other people, that releases oxytocin, and oxytocin is that bonding and feel good chemical alongside dopamine.
Yeah. And that's the basis of one of the three main bases for behavioral activation in cognitive behavioral therapy. And I'm guessing, and we can think about whether it's therapy or coaching. We can think about just the very nature of the relationship that we have to have in the room with people as well, and how that is the foundation and the baseline of anything that we do with people, is having that connection, social connection with them.
Oh, brilliant. Well, do you know what? That actually makes me think of another question then. And that is, if we can, and this is probably the big one. And
Dave, you look really excited, by the way. I need to just point out, you're looking really enthusiastic about this.
I am. I am. But I mean, the whole reason for the conversation is, what's the difference between therapy and coaching? Now, we and you're the therapist, I'm the coach, but I do think that there's a big overlap, or there is an overlap, and so, if I could couch this as, you're trying to explain this to a friend down the pub.
Yeah.
how would you do that? Can you do that?
Gosh, it is. Do you know, it is hard. I was actually on holiday recently, and I met a lady. We was in a group. Met a lady who is a coach over in Australia, and we were
Wow.
talking about what is the difference between. We were talking about difference between coaching and supervision, clinical supervision, but also with therapy. And we recognise that there's this massive overlap. And we were talking about how there can be quite a lot of misconceptions about what one is over the other. So, especially with CBT, with cognitive behavioural therapy, sometimes people will think, compared to, say, counselling, that CBT is quite kind of directive and that you are giving people information, that you're directing them on things that they need to do. But actually, it should be, if it's done well, very guided and very much, what do you want to achieve? What do you want to change? What would you like to work on? Okay, let's think about the theory together, maybe. Let's think about what's happening for you now that's causing things to maintain as a problem. And then let's think about what would you like to do to shift it, with the idea that if you can look at the theory and what's keeping the problem going, naturally that person will come up with their own solutions. And it's that the guided insights for people to kind of go, oh, to have that moment of, oh yeah, maybe I need to do something differently, or maybe I need to think differently about this. And I'm not a massive expert at all on coaching, but I kind of guess that that is around you're guiding people to achieve what they want to achieve. Is that right?
Yeah. Yeah. You're absolutely spot on. And so for me, when I'm working with somebody, what we are looking at the way forward, and not the way, not behind
Not
us, as it
back.
were.
Yeah.
So
Yeah.
and what I love to try and do is help somebody. I mean, I guess metaphorically, kind of, identify what the obstacle is, and then how can we reframe that? How can we look at it in a different way, such
Yeah.
that we can get a new perspective that might give us an opportunity to have an idea about how we can move forward, how we can, because I think there's something about that hazard focus almost of, when you're super focused on the problem, and again, when we're in that fight or flight mode, we know that the prefrontal cortex wants to be shut down and becomes less effective, and our amygdala is saying, pay attention to this one thing. So, and I think what coaching can help somebody do is be less hyper focused, like laser like focused on what this one problem is, and almost kind of, sit up and sit back for a second and open our vision up and going, is there another way we can look at this?
Yeah.
Are there other options? What might some of the other options look like? And that then potentially gives somebody the freedom to then go to choose a different path or a different option that then suddenly helps them move forward.
Yeah. It kind of feels like that. So there's for both, and I think CBT is different to some other modalities of psychotherapy in that it is more forward than back. It looks at, sometimes it goes back, but especially with trauma. But more often it's about what's keeping the problem going now. What do we need to do to change things, which is very similar. But I suppose one of the differences I'm thinking is yours is more about development and progression, and whether, I don't know whether it's about performance and about self-actualization.
Yeah.
Is that side of things. If people are coming to therapy, it's usually because sort of from I'm trying to think of the right word, but things are problematic from a disorder's perspective. It's sort of from a medical model, it's more kind of, I'm not functioning in a typical way at the minute. I am struggling, that word again, but that I'm struggling to an extent that is seen as abnormal in society. And I need to do something to get back to where I feel I need to be. Whereas it feels like in coaching, it's more about kind of, you're here, but you want to progress even more. I don't know. It's less pathological.
I think I mean, I think that's fair. I think that's, I don't think that's, I do. I think that's a fair assessment, really. I think there's, from a coaching point of view is, I'm here, but I don't want to be here. I want to be I want to know more. I want to be able to do something differently, but I'm kind of stuck in my rut, in my modality. and
Yeah.
I want to be the best or a better version of what I currently am. And I think the other thing is, and you've touched on that, you mentioned about performance coaching, is I think coaching is often, I mean, we're still in the infancy of it, I think, but there's a whole raft of different, people call themselves different types of coaches, whether that's a well-being coach or a life coach or a performance coach or an exec coach.
Yeah.
And I think they're very similar. And I guess they're also slightly different versions, because, again, from therapy, you're talking about CBT, and I guess there's different coaching styles, but a lot of them, a lot of the questions and the way we ask questions, hopefully they're all the same, because they're, what we want to do is ask open-ended questions that elicit thought and longer reflection and longer answers, rather than just the closed down yes no.
Yeah. So we're saying they're the same thing then, Dave?
We're saying there's a lot of crossover. We're saying they're very similar. Yeah, we are. So the more, I think, arguably, we could spend ages just agreeing that it is. It's brilliant. Fantastic.
I mean, I say that, and there are times, and I don't know if this is the same in coaching, but there are times in therapy where you do become a little bit more directive. So I suppose an easy example is risk. If you're presented with somebody that you're working with you feel is a risk to themselves, sometimes you can't always be guided and giving choices, and ethically it's got that, if we think about those kind of ethical principles, that sort of non-maleficence, beneficence bit of kind of, we want to give people autonomy, but at the same time that kind of conflicts with the need to make sure they're safe and to do no harm. So I don't know how that fits with coaching, because you're less concerned, I'm guessing, with asking people, do you ever think about harming yourself and ending your life, which is something we would do as standard in therapy. So there are times we'd be a little bit more guided if we thought that person was at risk of harm to themselves, or their choices were leading to them not being safe.
I mean, I certainly think from my own coaching practice, and again, because this links to my previous practice of working in mental health, of that the safety aspect and the risk and is there to a degree, but not so much, because once I'm assured that person is safe and well, then it kind of doesn't really rear. But I think compared to some coaches I talk with who don't necessarily have that clinical background, I don't think that necessarily rears its head as much.
Okay.
But it does in me, just because of, and again, that comes back from that experience. We coach from our own experience, and so I have a degree of that, but again, it's very small.
Okay, but I'm guessing as well with coaching, it depends who you're coaching. So if you're, so both of us from health backgrounds, that if you were coaching somebody who was working in a public service like health, that you have to not necessarily just consider the risk of them, it's the people they're working with as well. So there's something about safeguarding the wider public and ethical practice and safe practice. So as a coach, you'll be hearing about where people are, where they want to get to, and your decision making or their decision making within a coaching session will need to consider other people and the consequences of what they're doing.
And actually that runs through for me when I'm supervising other coaches, of helping, and that's not to say that I'm being critical about their work. It's about helping them understand the standards that we're working in, and helping them learn and progress new tools and techniques to improve their game. But also, are we working in a way that is always has the client at the heart of the coaching, and I guess we'll from a clinical background, we talk about person-centered care, don't we, or patient-centered care. So if you just change the word patient to client to customer, and I know that from a clinical point of view, we often don't like the idea of customer, but I think I think that, you know, if we think ourselves as customers, sometimes if we go to a restaurant and we had bad service, I'm not going to go back to that service.
Yeah.
But yet somehow I'm kind of have to go back to the NHS to a degree. But you know, somebody coming for therapy or somebody coming for coaching, if I deliver a bad service, then they'll vote with their feet, won't they? So how do we make sure that we're working in a way that is beneficial for the person, the customer, the client?
Yeah.
I
And
think
I
is really
suppose
important.
that maybe this is, I don't know, but maybe this is a difference between therapy and coaching, is that, and again, this is a very CBT example, but we would use certain things to make sure that we were getting feedback on whether it's on the experience of the session, but also on making sure that we've got the patient's or the client's voice. So we would use outcome measures to help with kind of making sure that we're evidence-based, but making sure that we're also considering their voice in hearing about change and things like that. I don't know, in counselling, in coaching, do you use that as well? Do you have measures and feedback tools to compare change, I don't know, goal-based outcomes and things like that?
I think widely, probably not. I think if that is probably more relevant if you have an internal coaching structure within an organization where they have a number of coaches and they'll want to see, you know, they might have throughput of, you know, how many people do you see? What were the outcomes? Did they work? Whereas I think independent coaches probably not so much.
So it's used more as a kind of governance tool, as a kind of measuring the services, rather than I want to hear your voice. This is another way that you can communicate with me. Yeah.
Yeah. But then, you know, so anybody that arguably any regular coach, any coach that's you know, that practices regularly and is part of a governing body will have supervision on a reasonably regular basis. And certainly what we'll do is, you know, in terms of broad strokes, what are the themes that are coming out of coaching that I then, you know, for me, what I then do is I go, okay, I'm responding in this way when this question comes up, and it's come up more than once. So I'll take this theme to my supervision and go, I've just noticed this. This is really interesting. And then, you know, we'll have a conversation about, you know, is it what's going on there? What's making me act in that way? What's, you know, is it, you know, is it coming from intrinsic or is it an extrinsic driver from, you know, from the client or from me?
Brilliant. That's exactly what we do in therapy as well. So it's another similarity. You do. And then in supervision, you look at it through different lenses. So you can kind of look at it about what's going on for you, what might be, like you say, what are the external factors, contextual factors, you know, surrounding yourself and the organization or the client. You look at the relationship between you and think about what's going on there, or about the particular modality of what you're doing, the coaching style or the therapy style. So it sounds like the supervision of coaching and therapy is very, very similar.
It's very similar. Yeah, it does, doesn't it? Do we still see that, you know, that it might be more acceptable to say I have coaching than it is to have therapy?
Yeah, I think you could be right. And I think sometimes the people who were the worst culprits for kind of stigmatizing themselves for mental health problems are people in mental health professionals. That we can kind of go, yeah, we can help people and don't be ashamed of your mental health problem. And then we have this, and I think mental health nurses in particular are bad for this, is that we can kind of go, I can cope with anything, throw it at me. Yeah, this wasn't a problem. This is fine. I feel absolutely fine. And it does come out, doesn't it? So I think there's something about our self-awareness of what's going on for us. It's probably a rule, going back to the rules bit, a rule we develop. I should be able to cope. think there's a culture. I mean, back in the late 1990s, mid 1990s, when I did my nurse training, mental health nurse training, it was very much like, oh, when I did my training, you were in charge of a ward and you got on with it in your 3rd year of training. You know, and it very much this culture of you should be able to cope with whatever's thrown at you. So I can understand why people want to call it coaching rather than therapy. But then there are some modalities of therapy where there's an expectation, not CBT actually, but where there's an expectation that you have your own therapy for the duration of your training. And if we think about things like, you know, self-practice, self-reflection, or, you know, as far as development, something about having self-awareness of what's going on for you is going to help you with development, and whether it's performance, achieving what you want to. But then should that be forced on people, or has it got to be at the right time for them? Because we all have different times where it's right for us to access therapy or coaching. It's got to be our choice, hasn't it, rather than forced onto us. Sorry, I've digressed there a bit, haven't I? Sorry.
No, do you know what? Because you're making me think about it's resonating with me on quite a lot of levels of, you know, at some level, you know, well, so what I'm thinking of here is, you know, when we have a conversation with somebody, with another person, it allows us to order our thoughts, because our thoughts aren't linear in the way that language is. And actually there's a couple of podcasts, there's some really interesting work done around linguistics that I think is super fascinating, that mean that we that culturally we learn, or we think about things in a different way. And an example of that would be, you know, if we talk about a bridge, for example. Now in English, a bridge doesn't have it's not male or female, where in some languages we have male and female words, don't we? So, you know, in German, a bridge is likely to be more masculine and male, and therefore we talk about a bridge being strong, robust, safe. Whereas in French, the word is female, so we might think of it more elegant and fine. So if we use language in those different ways, we have to think and hold ideas and notions in different ways. And so I think there's something really interesting about having a conversation that allows us to order our thoughts in a way that then makes it more real and tangible for us, where, you know, when we're kind of half thinking about something. What I love about in coaching is whether it's myself or somebody says, no, I'm going to do that, the act of voicing it increases the likelihood of it happening, because I've voiced it. Whether I see you again is almost irrelevant. The fact that somebody out there, if I might see you again and go, oh, how did you get on with, you go, I didn't, you know, you don't want to say, oh, I didn't do it.
No.
So I think
it gives you that kick up the bum, doesn't it?
That's it. Right, so I think there's something about having a conversation with, whether that's in supervision, whether that's coaching, that allows us to order our thoughts and make sense of things that we're struggling with, and potentially increase that motivation because I've said I'm going to do something.
Well, it is reflection, isn't it? If I don't want to go all too theoretical, but if you think about Kolb's experiential learning cycle, you experience something. If you have the opportunity to reflect on it and to make sense of it, it then naturally leads on to kind of, right, okay, so what next? What am I going to do? But also that very deliberate act of reflecting on action. I am going a bit theoretical now. Now I'm thinking about, I can never say his name, is it Sean? But he says, you know, the more that you reflect on your action, the more that then when you're in a situation, you can become better at reflecting in action when you need to. But if you don't reflect on it deliberately, specifically, how easy is it for you to develop it with your responses when you're then in future situations?
Yeah.
So it's the act of deliberate reflection, isn't it? Encourage.
And I guess the other crossover we'll experience there is about not leading the person, but helping them come to their own conclusion about that. So,
which is hard, isn't it?
Yeah, and I think that's big chunk of the training that we probably both do, of having to learn to sit on our hands metaphorically, and not go, that's it, do that.
Yeah, yeah. And if you're testing something, because there's a big thing in CBT, it's very empirical kind in therapy, but it's all about kind of thinking about things in quite a scientific way and testing it out. So if somebody's got a belief about, I don't know, if I walk into a room, everybody's going to look at me and laugh. There's something about kind of, if we're going to test that out, which is quite a bit like me on a plane. Well, how do we know if it's going to crash? You've got to kind of put yourself through that, haven't you? But there's something about testing it out with genuine curiosity, not thinking, well, I know the answer to this.
Yeah.
You should do this because then you will learn X, Y, and Z. But it's more kind of, okay, what could you do to test this out, to look at how valid, how accurate that belief is, or how helpful is that belief? This is something you could do. But you have to do that, like you say, sitting on your hands with real curiosity to kind of go, gee, this could all go very, very wrong. I once had a lad, a young lad that I was seeing for therapy. This is a long, long time ago. But he said that he was worried about leaving the house because he was worried that he was going to get bullied, and that he didn't feel that he'd be able to do it. And there was nothing safeguarding wise that made us think at that point it's going to happen. But we did a little bit of an experiment where he's going to go around to the shop with his sister as a way of just trying to encourage him to gradually kind of face the world again. And he went out the house and there were some lads and they started having a go at him. And the worst happened. And it was like, But what was really helpful was that he stuck up for himself and he got through it, and he realised that the worst could happen and he'd still be okay. So he actually then felt more able to go out the house with his sister, but go out the house. So you just never know, do you? Kind of, we can't direct people, we can't advise, because we don't know what's going to happen. They've got to find it out for themselves and their own experiences.
Yeah. So there's I'm almost hearing there like a bit of an unconscious if-then plan, in that, he'd made the plan to go out. The worst happened, but he managed to stay or not be completely overwhelmed by that fight or flight stuff, and then enact an if-then. Actually, they came up, the worst was happening, but he stayed focused enough to say,
so if I go out, then I will get attacked.
Yeah.
And it's like, and if that happens, then what? Was the belief that he was able to challenge through doing that. So win-win. Win-win.
Wow, brilliant. And that's very much, I love those if-then plans in coaching, because they're, if, when we talk, I often work with, not often, but I regularly work with people with imposter syndrome, particularly if they've gone, they've just got a new job. Or how they're getting ready for a next job and going, am I able to do that? And that imposter syndrome often comes to the fore. And actually, if-then plans are brilliantly useful for helping people regulate their own emotion, don't we? And I love that idea of regulate first, think later.
Yeah, and we do this, don't we, with kids in school? This kind of, that. This is the bit I think that people can get wrong, especially, I'm not blaming teachers for this, and parents are the same. But what we do with young people, especially, but even with adults, if people are dysregulated, we try to reason with them straight away, don't we? And I can never remember. It's either Bruce Perry or Bruce Parry. I know one of them goes and works with tribes and the other one's the bloke that writes about this stuff. But anyway, it's one of the Bruces. And what he says is that you need to regulate before you relate to people, before you reason with people. Right, but most of us, when I don't know whether we're a parent that's dealing with a distressed child or a teacher or whoever, we will try to reason with somebody before they're actually regulated, and it just doesn't work, does it? You have to deal with that emotional intensity first.
Yeah, and actually, I think there's also some really interesting neuroscience there about of mirror neurons, and when somebody's in a heightened emotional state, then we naturally want to match that, because that activates the same sort of fight or flight response in us. And actually being aware of that as a coach or as a therapist, we're then trying to downplay that, downregulate that, and hopefully that our calm will then rub off on the other
Help with
person,
the
and
relating. Yeah,
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 and
yeah,
then they can have we can bring their prefrontal cortex back online, and hopefully they can, make better decisions.
yeah,
So,
yeah.
wow.
So,
Well,
but when you're time limited, whether it's in coaching or in therapy, I think sometimes even we can get
yeah,
into that habit of kind of trying to help people to reason or to see things differently, but they're not in a place to do it. They're just far too heightened. So we have to attend to that. Another similarity with therapy and coaching.
yeah. So I think I'm really interested then about if there are some myths that we could bust in this conversation, what might those myths, do you have a couple of kind of things that you think people really ought to know and not know about therapy?
Well, I was going to say, oh, right, okay, about therapy. Because one of the things, it's not necessarily about therapy, but one of the things that sounds so obvious. But my daughter, when she was 13, she's a bit older now, but when she was 13, I remember her saying to me, I can't remember what we've been talking about, but she went, "Oh, is anxiety normal then?" And I kind of almost had my head in my hands, like, "Oh my God, my own daughter doesn't realise this is a normal emotion." So I suppose one of the things that's kind of a bit of a myth nowadays is that intense emotions are abnormal or pathological and that you shouldn't be experiencing them. So when people come to therapy and they talk about experiencing strong emotions, I suppose that's one of the myths that I have to try and help bust with people,
Right.
is they shouldn't be feeling that way. That's not necessarily about coming to therapy, but it is this, I suppose, the myths that can be around kind of somebody's going to do something to you and that you're passive in this,
Mm.
uh, or that therapy is going to mean that it's this magic wand,
Yeah.
which we know there isn't. It does take motivation. It does mean putting yourself through the intense emotions. It does mean taking risks. I
Yeah.
suppose that's the bit that I'd want people to know. What about with
That,
coaching?
well, do you know what? There is. I think what you just said there is almost exactly pretty much exactly the same story, really. Of I was doing some well-being work with some people, or with a group and an organization, and we got a call which was somebody's in distress, get the well-being team.
Yeah,
So, so I went to have a conversation with somebody, and actually, you know, they were upset about something, and that's pretty exactly as you just described there. And it was just a completely normal reaction. They were just upset about something, which, you know, if you're, if you've got £20 left in your bank account and your washing machine breaks, then you could be a bit upset about that,
yeah,
or your partner leaves you, or the car breaks down and you're late for work. That they're going to have emotional reactions to those, and those are completely normal. And actually, there's something about just helping people be aware of their emotions are just their emotions, and that's fine, and that's part of being human, isn't it? It's
it
part
is,
of
isn't it?
just who we are, that says, yeah, it's fine.
Yeah. So it's normal to feel what you're feeling. It's normal for you to think what you're thinking, given what you're going through. And it makes sense that you respond in the way that you are doing because you're trying to keep yourself safe. It might not be
Yeah,
helpful in the long term, but in the short term, that you'll have had an experience where that's been really helpful for you. So it kind of almost it allows people not to feel that shame or embarrassment to kind of go, actually, you're not as abnormal as you think you are.
yeah,
You
yeah.
can do that. Yeah.
Brilliant. Well, I'm aware that of our time. We've had a hell of a conversation. So thank you
We've been
so
all around the
much for that.
houses, haven't we?
We have, haven't we? We have. So I think I so what I'm getting out of this is that coaching and therapy, while different, have some significant overlap. Um,
Massively, yeah. Yeah.
and um, and actually, maybe there's something about there of going, if you're feeling in that you're, well, no. So what would your point be if you're working with somebody that feels they need coaching or therapy? What would you say to that person that's listening
Do
to
you know,
this?
I don't know if this is a bit controversial, but I think I'd want them to consider semantics. And it's kind of actually, let's think about what we're calling things. We do this all the time in mental health and in therapy, is that we will use different words to describe the same thing because we're maybe being a little bit precious about our modality of working. Is that, does it matter which you go with? It's about what's going to work for you. What would you prefer it to be called? It could achieve the same thing. I mean, there are practicalities. If you are accessing therapy in a health service and you are somebody who's functioning well but wants to develop yourself, you're probably not going to be able to access a therapy service through the NHS. You might have to go privately to access therapy, or you might be able to access counselling a lot easier. So it might be the practicalities about whether you choose one or the other, depending on what's available to you. But otherwise, it's actually, does it matter which you go with?
Interesting topic.
I don't know
Interesting
what you
idea.
think about
No, I mean, I think, yeah, I think if you're feeling that it's affecting your, if whatever's going on for you is affecting you psychologically, and you're, you're having sleepless nights and that, and you're it's having a real significant impact, then you might want to talk to your GP in the first instance. If you're having real high emotional responses like depression or anxiety, and they're going on for longer periods. But if you're thinking, how do I become a better version of myself? How do I improve this? How do I change my thought? Maybe coaching.
Yeah, I can agree with that, definitely. Yeah.
Brilliant.
Sorted.
Well, I mean, sorted. We put the world to rights for another time. Well, look, Zoe, it has been a pleasure talking with you.
Yes, it has
thank
with
you
you
so
as well.
much.
Thank you.
You're welcome. And maybe we'll see you again on another podcast down the line.
I'd like that. Thank you. I've really enjoyed it. Thank you very much, Dave.
You're welcome. Thank you very much. And we'll see you on the next one, guys. So thank you.